you can get your shoulder better by not having to do an operation. And that's part of why I want to give these talks, so that people know, separate from, say, an arthritic knee that probably isn't going to get any worse the longer you bite on a stick. If you have a shoulder that's real sore, a shoulder problem can become a much bigger deal if it's not addressed early on. And if we address it early on, frequently we can avoid doing an operation that puts people sort of on the shelf for 6 to 12 months total recovery time. Because people say 6 to 12 months, that's half a year to a year. No matter how we do that math, it's a long time for if we have to fix things. This is just sort of the motley crew of my colleagues and I at Heartland Orthopedic. Our office is just down the hallway. In the group, we do joint replacement care, simultaneous or bilateral knee replacements, sports medicine we're talking a little bit about. We have a couple of awesome physical therapists and athletic trainers who work with them. We really can care for you from your shoulder down to the tip of your fingers, hips and knees, and then Dr. Stika, Angie mentioned, also does even things like ankle replacement, which is a pretty unique situation for us to be able to offer that. So we're going to talk a little about shoulder anatomy, different kinds of conditions. Some of these are more sporting kinds of things, like the 18 to 22-year-old kid that crashes into people or dislocates their shoulder, but we'll talk a little bit about something called frozen shoulder, rotator cuff problems. And most everything, I call it the orthopedic buffet, whether we're talking about your sore knee or your sore shoulder or your sore hip. One end of the buffet is don't do anything. The other end of the buffet is do a big operation that has significant recovery time and more risk than doing nothing. And then in between are things like therapy, medicines, injections, where we kind of figure out where you are along that buffet to say, well, what's the right thing for you right now? So we want to get you better with the least amount of invasion of you. So the least invasive stuff, the less risky is the better. But also we want to make sure that if what we really need to do is just do an operation, then we don't fiddle around doing stuff that's not going to get you better. We look at the shoulder. This is front-on view of a right shoulder. So there's a ball in the socket. The socket in the shoulder is called the glenoid, and there's a bunch of medical mumbo-jumbo that we can sort of skip around with. There is a joint between the collarbone and the edge of this is part of the shoulder, really called the acromion. We call that the AC joint because we don't want to say acromioclavicular all day long because it kind of gets us tongue-tied. Unique stuff about the shoulder is that if we take the ball away from the socket, here's the socket, we're looking face on, we've taken the ball away, is that it requires these muscles around the edge called the rotator cuff, which is a group of muscles in order to keep the ball in the socket. Our shoulder joint is different than the hip joint. The hip joint's a real deep ball and socket joint. The shoulder joint is a pretty shallow ball and socket joint, which gets us to an analogy that kind of fits with spring of the golf ball sitting on the golf tee. Whether you're a golfer or not, we can follow this along pretty well and say, well, the golf tee is not a real shallow thing, so the golf ball can fall off the tee pretty easily. Same thing happens with our shoulder. So when we're working with the shoulder, we really rely on this guy cut away here that's kind of red and white is the rotator cuff. There we go, Angie.
Oh.
There we go. Well, let me try it again.
I do that all the time.
Thanks. There we go. So this group of muscles or tendons helps keep the ball seated in the socket, keeps the golf ball on the tee. If you want something to impress your neighbors with at the next neighborhood barbecue, you can tell them that I learned today that the rotator cuff is made up of 4 muscles, and they've got these long words: supraspinatus, infraspinatus.